Okay, let's unpack this. Today, we're diving into, well, one of the most incredible journeys the body goes through after childbirth.
Hmm.
We talk a lot about pregnancy, right? But what about afterwards? Those pretty profound physiological shifts in the new parent. It's not just about the baby, it's this whole transformation.
Absolutely.
So our mission today, our deep dive, is using expert notes, lectures, that kind of thing, to really get into the nuts and bolts of postpartum recovery. But we want to give you a shortcut, basically, to understanding what's actually happening physiologically.
Mm.
Essential info, whether you're a new parent, helping one out, or just, curious.
And it's so important because, look, the body doesn't just bounce back. That's a myth.
Right?
It took 9 months to grow a baby, and it takes time, often 6 to 8 weeks for a lot of systems, sometimes way longer for others to recover. And normal postpartum is, well, it's its own unique state. It's really different from regular adult physiology. Understanding that is key.
Okay, so let's start right at the beginning. Those first checks after birth. What are the immediate concerns? What are we looking for? Our sources really hammer home that the biggest immediate worry is postpartum hemorrhage, PPH.
Yeah, that's top of the list. Excessive bleeding. It's the most common serious complication right after delivery.
So how do we monitor for that? Vital signs, obviously, but you said it's different postpartum.
Exactly. There's a postpartum twist. Take temperature, for instance. It can actually be slightly elevated, maybe up to 100.4 Fahrenheit in the first 24 hours.
Oh, really?
Yeah, just from the stress of it all, maybe a bit of blood loss, dehydration, it's usually okay. But if it goes higher or stays up past that first day, then you start thinking infection.
Okay, so a little warmth is expected, but keep an eye on it. What about blood pressure? Does that change much?
Usually, no. It should stay pretty close to whatever their baseline was during pregnancy. That's why knowing their pregnancy BP is so important.
Right.
A significant drop could mean bleeding. A sudden increase, though, that could be postpartum preeclampsia, which, yeah, can still happen after the baby's born.
Wow, okay. And pulse. I think I read something about puerperal bradycardia. Sounds fancy.
Yeah, it does. But it's actually fascinating. Often the pulse slows down postpartum, maybe 50 to 90 beats per minute. It's considered benign, normal.
Slows down. Why?
Well, think about it. The circulatory system suddenly doesn't have to support the placenta anymore. All that extra blood volume starts shifting. So the heart kind of recalibrates. It becomes more efficient temporarily.
That's incredible. The body just adjusts.
It really does. However, tachycardia, a pulse over 100, that's a big warning sign.
Okay.
That usually means the heart's working too hard, maybe compensating for blood loss, like hemorrhage, or it could be fighting an infection.
And breathing. Oxygen levels.
Generally stable. Back to pre-pregnancy levels. Big changes there might just be anxiety or maybe an effect from pain medication.
So frequent checks are key then, especially early on.
Absolutely crucial. Like BP and pulse every 15 minutes for first couple hours. Temperature every 4 hours for the first 8. Really watching for hemorrhage and infection starting.
Okay, that makes sense.
Yeah.
Now let's talk labs. You mentioned things can be skewed. What does that mean exactly? It sounds confusing.
It can be. It means we can't just look at the numbers like we normally would. Take hemoglobin and hematocrit, and your red blood cell counts.
Okay.
They might drop. And yes, a big drop, say over 10%, can mean hemorrhage. But there's also this thing called hemodilution happening.
Hemodilution. Break that down.
So during pregnancy, you build up a lot of extra fluid, right? After birth, the body starts getting rid of it fast through lots of urination. That's diuresis and sweating, diaphoresis.
Right, getting rid of the extra fluid.
Exactly. And as that fluid leaves the bloodstream, the blood that's left becomes, well, less concentrated for a bit, diluted.
Ah, so the H&H levels might look lower just because the blood itself is more watery temporarily.
Precisely. And labs are often drawn the morning after delivery, so those numbers aren't always the best immediate snapshot of active bleeding right now. They're part of the picture, but not the whole story immediately.
That's a really critical point.
Yeah.
What else is skewed?
White blood cells, your WBCs, they fight infection. Postpartum, they can shoot up like 20,000, even 25,000, and stay high for days.
And that's normal.
Yep, considered normal. Just the body's stress response to delivery and all the hormonal shifts. It doesn't automatically mean infection, which is, different than usual.
Okay.
Also, clotting factors. They increase during pregnancy to help prevent bleeding during birth, and they stay high for a while afterwards. Good for stopping hemorrhage, but it does slightly increase the risk of blood clots. DVTs, PEs.
So with labs being a bit tricky right away,
Yeah.
How do we really know how much someone is bleeding? What are the key things to look for?
Great question, because you're right. PPH is the big immediate danger. We rely heavily on clinical assessment, what we can see and feel, versus lochia.
The discharge after birth.
Exactly. We look at the color, it changes over days and weeks. Starts bright red, rubra, then pinkish brown, serosa, then yellowish white, alba. We look at the amount. Is it scant, light, moderate, heavy? And importantly, is it soaking a pad very quickly, like in less than an hour? That's a major red flag.
So going through pads too fast is bad. What else?
Foul odor, that suggests infection. And
Well,
checking under the person. Blood can pool, especially if they're lying down. You might miss it otherwise.
good point.
And then, crucially, fundal assessment. Feeling the top of the uterus, the fundus, it should feel firm, like a grapefruit, and be coming down in the abdomen day by day.
What if it doesn't feel firm?
If it feels soft or boggy, that means the uterine muscle isn't contracting properly. Those contractions are what clamp down on the blood vessels inside. A boggy uterus means those vessels can just keep bleeding.
So you need it to be firm.
Yes. We do something called fundal massage, basically rubbing the fundus firmly to encourage it to contract and firm up. It's vital.
Okay, wow. So much focus on that immediate period. Let's broaden out a bit. What else is happening? The whole body's recalibrating, right?
Oh, absolutely. It's a system-wide reset. Neurologically, for example, any nerve issues from pregnancy pressure usually start to resolve. Headaches are super common, though.
Yeah, I bet. Lack of sleep, stress.
Dehydration, hormones, all of it. But we do watch out for specific types, like a spinal headache after an epidural, or a severe headache with high BP, which could still be preeclampsia.
And hormones, that must be a roller coaster.
Huge shifts. When the placenta is delivered, estrogen and progesterone levels just plummet. That big drop signals the pituitary gland to release prolactin.
Ah, the milk hormone.
That's the one. It ramps up milk production whether you plan to breastfeed or not. The body just kind of gets ready. Thyroid function also adjusts, usually back to normal by 3 months, but sometimes postpartum thyroiditis pops up hypo or hyper symptoms.
And fertility. When does that come back?
It can be surprisingly quick. For people not breastfeeding, ovulation might return in like 45 days, maybe up to 95.
It's pretty fast.
Yeah, and this is critical. Breastfeeding is not reliable birth control. Even if periods haven't returned, ovulation can happen. So contraception needs to be discussed early.
Definitely good to know. What about muscles, joints, that sort of thing?
Well, abdominal muscles obviously need time to regain tone. And joints that got looser during pregnancy, remember relaxin hormone? They start tightening up again, returning to their usual flexibility.
And skin changes from pregnancy. The mask of pregnancy, linea nigra.
Yeah, cloasma, the linea nigra, darkened areolas, those things usually fade over months. Stretch marks might fade, but often stick around to some degree. And hair loss is common too.
Hair loss.
Yep, often around 3 months postpartum, it's that hormone shift again. Telogen effluvium, it's called. Usually temporary, thankfully.
Okay, there are so many moving parts here. It's a lot to track. Our sources mentioned a helpful acronym, BOBLEE, to kind of organize the assessment.
Yes, it's a great framework. Really helps cover all the key postpartum areas systematically, sort of a head-to-toe check.
Let's break it down. First, B.
Breasts. Hormones, get them ready. Blood supply increases. The areola darkens. And then when the baby suckles, that triggers oxytocin.
Which also helps the uterus contract, right?
Exactly. Multitasking hormone. And prolactin for milk production. You get colostrum first, that amazing liquid gold packed with antibodies. Then transitional milk after a few days. And finally, mature milk.
What about engorgement? That sounds uncomfortable.
It can be. Usually happens around day 3 when the milk really comes in. Breasts feel full, firm, maybe tender. Best thing for it is frequent feeding or expressing milk.
And what are we checking for? Problems.
We look for redness, excessive tenderness, heat. Cracked nipples are common, usually from a poor latch. And we watch for mastitis, which is a breast infection, usually shows up as a red wedge-shaped area on one breast, often with fever and flu-like symptoms.
So education on latch is key.
Crucial. Proper latch, frequent feeding, supportive bra. If someone's not breastfeeding, then a snug bra, maybe ice packs, cabbage leaves sometimes help, and definitely avoiding nipple stimulation so you don't encourage more milk production.
Okay, next letter. U for uterus.
Right. We talked about involution, that process of the uterus shrinking back down. It takes about 6 to 8 weeks to get back to pre-pregnancy size. Those contractions that shrink it down can be felt, especially when breastfeeding. Those are after pains.
Are they bad?
They can be pretty crampy, yeah, especially for people who've had babies before. Usually taper off after about 3 days. The opposite of involution is subinvolution, where the uterus doesn't shrink properly. That can cause ongoing bleeding.
So assessment is checking that it's firm, midline, and descending like it should.
Exactly. Palpating the fundus. And if they had a C-section, checking the incision too. Using Rita, looking for redness, edema, ecchymosis, bruising, discharge, and approximation. How well the edges are together.
Got it. Then we have two B's together.
Bladder and bowel. For bladder, after birth, sometimes there's difficulty voiding, maybe some swelling or effects from an epidural. Urinary retention can happen, and a full bladder is bad news for the uterus.
Right, you can push it out of place and stop it contracting.
Precisely. Plus, the body is doing that massive diuresis, getting rid of fluid so the bladder fills quickly. We encourage trying to pee frequently, check if the bladder feels distended, push fluids. Comfort measures like ice packs, peri-bottles for rinsing, sitz baths really help down there.
And incontinence can be an issue too.
Yeah, urinary incontinence affects maybe 30% postpartum. Kegel exercises are really important to strengthen those pelvic floor muscles again.
Okay, and the second B, bowel.
Appetite often picks up, but constipation is super common. Lots of reasons. Diet changes, dehydration from fluid shifts or labor, pain meds like opioids slow things down, and sometimes just fear of that first bowel movement, especially if there were stitches.
Understandable.
So we listen for bowel sounds, encourage walking, fiber, lots of fluids, maybe stool softeners. Hemorrhoids are also really common from pregnancy pressure and pushing.
All right. Next is eloquia. We touched on this, but let's recap.
Yes, the discharge, remember the progression. Rubra, red, 3 to 4 days. Then serosa, pink-brown up to day 10. Then alba, white-yellow, day 10 onwards, can last weeks.
And assessment is color, amount, odor.
Exactly amount. Scant, light, moderate, heavy, saturated. Saturated means soaking a pad in less than an hour. That's too much. We sometimes weigh pads. 1 gram roughly equals 1 LOL of blood loss.
What are the big warning signs with lochia?
Going backwards, like back to bright red rubra after it was already serosa or alba, soaking a pad in an hour or less, passing big clots larger than a golf ball or maybe a chicken egg, a really foul odor, fever or increasing pain along with changes, those all need checking out.
Okay. Next E is for episiotomy or lacerations.
Right. An episiotomy is that surgical cut, sometimes done to make more room. Lacerations are natural tears that happen during birth. They're graded by severity, 1st to 4th degree, depending on how deep they go.
And the concerns are infection, bleeding.
Those are the main ones.
Okay.
So again, we inspect using Rita, looking for infection signs, making sure it's healing. Comfort is huge here. Ice packs, peri-bottle for cleansing, sitz baths, maybe topical numbing sprays, pain relief meds.
Makes sense. And the last two E's.
Extremities and emotions. For extremities, we're mainly looking for blood clots, VTE, DVT, PE. Remember, those clotting factors are still high.
Right. Increased risk.
Increased risk, plus maybe less mobility right after birth. So we check the legs carefully. Any swelling, redness, tenderness, one leg warmer than the other. Early walking is key for prevention, maybe compression devices too.
And the final E's, emotions. So incredibly important.
Absolutely vital. And those massive hormone shifts play a huge role here. The postpartum blues are super common, feeling weepy, moody, overwhelmed. Usually hits in the first few days and resolves within about 2 weeks. That's considered normal.
But then there's postpartum depression.
Yes, postpartum depression, PPD, is different. More severe, lasts longer than 2 weeks, can interfere with daily life and caring for the baby. It might need treatment, like therapy or medication. It can actually show up anytime in the first year.
And postpartum psychosis.
That's rare, but it's a psychiatric emergency. Can involve delusions, hallucinations, and sometimes thoughts of harming oneself or the baby. Needs immediate help, like call 911 immediate.
So assessment involved observing mood, how the parent interacts with the baby.
Yes, and talking to them using screening tools sometimes, like the Edinburgh scale. Encouraging bonding skin to skin, rooming in is great. And strong social support makes a huge difference. Partners and family need to know the signs too.
Okay, so bringing it all together, the BUBBLE framework covers a lot. The main goals postpartum seem to be spotting problems early, especially bleeding, keeping the person comfortable, teaching them about self-care and baby care, and helping that bonding process.
That sums it up well, and that leads right into discharge teaching, preparing them for going home.
What does that typically cover?
Key things are self-care, how to manage perineal or C-section incision care, breast care, whether feeding or not, importance of rest, good nutrition, hydration. Reviewing the complications, what specific warning signs to watch for from all the systems we just discussed.
Like knowing when to call the doctor.
Exactly. Understanding their medications, what they're for, how much to take, any side effects. And really importantly, talking about contraception again and when it's generally safe to resume sexual activity, usually after the 6-week checkup if healing is good. Reinforcing that breastfeeding isn't birth control.
And our sources had another helpful acronym for those warning signs at home, right? Post-birth.
Yes, that's a great one for remembering when to seek help urgently. Pain in the chest, obstructed breathing or shortness of breath, seizures, thoughts of hurting yourself or the baby, that's a 911 call.
Right.
Bleeding soaking through a pad in an hour or big clots, egg-sized or bigger. Incision that's not healing, looks infected. Red or swollen leg, painful or warm to touch could be a clot. Temperature, a fever of 100.4 F or higher. Headache that's severe, doesn't go away with medicine or affects vision.
That's a really clear list. So reflecting on all this deep dive really highlights just how incredible and frankly complex the postpartum recovery process is. It's not just getting back to normal, it's a whole physiological journey. Understanding these changes, knowing what's expected, and what's a warning sign that empowers everyone involved, doesn't it? New parents, partners, families.
It absolutely does. Knowledge is power here. This whole intricate, often invisible process of healing and adaptation, it just showcases the body's amazing capacity. And maybe, just maybe, understanding this better can help us all have more empathy, provide more effective support, and really honor the immense transformation every new parent goes through. It's a profound time and deserves that recognition and care.
A powerful thought to end on. We hope this deep dive has given you valuable insights into the postpartum journey. Keep exploring, stay curious, and thanks for joining us on the deep dive.